My friend, if you are a man over the age of 50, I want you to listen closely. Because one of the most common yet least talked about health challenges in men is prostate enlargement, also called benign prostatic hyperplasia or BPH. And while millions of men silently suffer from it, the truth is, you don't have to live in discomfort. There are simple, natural exercises you can do, right from your own home, that can help reduce pressure on your prostate, improve bladder function, and give you back the freedom and confidence you deserve. Now, let's be real. When the prostate enlarges, life becomes uncomfortable. You may find yourself running to the bathroom several times a night. You may feel like your bladder never empties completely. And in some cases, it can even interfere with intimacy and daily energy. It's frustrating. It's tiring. And too often, men simply accept it as a normal part of aging. But let me tell you this, normal does not mean unavoidable. Science is clear. Lifestyle plays a powerful role in supporting prostate health. And movement, specific, targeted exercises, can ease symptoms naturally. Before we dive into the exact exercises, I want you to set a powerful belief in your mind. Your health is not slipping away. Age is not your barrier. With the right habits, you can reclaim control over your body. Discipline and consistency are your tools. Vision is your guide. And every small action you take compounds into strength, vitality, and freedom. In today's video, I'll walk you step by step through a series of simple exercises designed to strengthen the pelvic floor muscles, improve circulation to the prostate region, reduce urinary discomfort, and restore balance to your body. These are movements men in their 50s, 60s, and even 70s can do safely. No gym required. So, let's begin with the first exercise, one that doctors and physical therapists around the world recommend for prostate health, the Kegel exercise for men. Now, you may have heard of Kegel exercises for women, but what most men don't realize is that Kegels are just as powerful, maybe even more important, for men over 50.
Why?
Because Kegels strengthen the pelvic floor muscles, the very muscles that support your bladder and control urination. When these muscles are weak, your prostate symptoms feel worse. But when they're strong, you can reduce urgency, improve bladder emptying, and even support prostate health. Here's how to do them step by step. Sit comfortably in a chair with your feet flat on the ground. Imagine you're trying to stop the flow of urine midstream. The muscles you engage are your pelvic floor muscles. Squeeze and hold those muscles for 3 to 5 seconds, then relax. Repeat this 10 times in a row. Try to do 2 to 3 sets daily. Now, a quick but important note, don't actually practice Kegels while urinating. This can cause more harm than good. Instead, train your pelvic floor at other times of the day, while sitting, standing, or even lying down. Empowerment plus real-life application. I've had patients in their late 60s tell me that within just a few weeks of consistent Kegel practice, they were waking up fewer times at night, feeling more in control, and noticing improved confidence in daily life. And this is what I want you to take to heart. Your body is listening to you. Every squeeze, every repetition, is a signal to your body that you are reclaiming strength, not giving it away to age. Transition to next exercise. So that's the first exercise, simple, discreet, and powerful. Now let's move to the second one, which not only benefits your prostate, but also boosts circulation and overall vitality. It's called the pelvic tilt exercise, and it's one of the best ways to gently activate your core and relieve pressure in your lower body. The second exercise is called the pelvic tilt. This simple movement directly supports the lower back, core, and pelvic region, all of which influence the pressure and circulation around your prostate. When you perform pelvic tilts, you're not only strengthening your abdominal and hip muscles, but you're also gently massaging the pelvic floor. This improves blood flow, reduces stiffness, and helps relieve that heavy, uncomfortable feeling caused by an enlarged prostate. Here's how to do it step by step. Lie flat on your back with your knees bent and feet flat on the floor. Place your arms at your sides for stability. Tighten your abdominal muscles and flatten your lower back against the floor. Hold for 5 seconds, then slowly release. Repeat 10 to 15 times, once or twice a day. The benefits: white heavy checkmark improved circulation to the pelvic region. White heavy checkmark reduced pressure on the prostate. White heavy checkmark stronger lower back and core support. In fact, Studies have shown that consistent pelvic floor and core activation can significantly improve urinary function in men with mild to moderate BPH. It's not about big, heavy workouts. It's about precise, consistent movements that restore balance to your body. The third exercise is the bridge. This movement is a favorite among physical therapists because it strengthens multiple muscle groups at once: the glutes, lower back, and pelvic floor, all of which work together to support prostate health. Why is this important? Because when the muscles around your hips and pelvis are weak, extra pressure builds on the bladder and prostate. The bridge relieves that pressure by activating and strengthening the supporting muscles. Here's how to do it. Lie flat on your back with your knees bent and feet flat on the floor, hip-width apart. Place your arms at your sides, palms facing down. Press your heels into the ground, squeeze your glutes, and slowly lift your hips off the floor. Hold for 3 to 5 seconds at the top, then gently lower back down. Repeat 10 to 12 times, 2 to 3 sets per day. The benefits include: white heavy check mark, stronger pelvic floor support. White heavy check mark, reduced pelvic tension and pressure. White heavy check mark, better bladder control and core stability. Even more, this exercise improves circulation in the lower body, which is essential for healing and reducing inflammation in the prostate region. The bridge doesn't just help your prostate, it also builds the foundation for better posture, walking, and daily strength. Every rep is an investment in your independence. The fourth exercise is the knee-to-chest stretch. This gentle movement is simple, but it has a powerful effect. It relieves tension in the lower back and pelvis, improves blood flow, and reduces the pressure men often feel in the prostate region. Think of it as giving your pelvic area a reset, loosening tight muscles, creating space, and allowing the body to function more naturally. Here's how to do it. Lie flat on your back with your legs extended. Gently bring one knee up toward your chest, holding it with both hands. Hold for 20 to 30 seconds, breathing deeply. Slowly release and switch to the other leg. Repeat 2 to 3 times on each side. For a deeper stretch, you can also bring both knees toward your chest at the same time and hold the position. The benefits: white heavy check mark, reduced pelvic and lower back tension. White heavy check mark, better circulation to the prostate region. White heavy check mark, improved flexibility in the hips and spine. This exercise is especially helpful before bedtime because it eases discomfort, relaxes your body, and can reduce those frequent nighttime trips to the bathroom. Remember, sometimes the most powerful exercises are also the simplest. It's not about intensity, it's about consistency and giving your body what it needs. The fifth exercise is the cobra stretch. This gentle yoga-inspired movement is widely practiced in Asia, and it's especially powerful for men dealing with prostate enlargement.
Why?
Because the cobra pose improves circulation to the pelvic region, stretches the abdominal muscles, and reduces stiffness in the lower back. This combination eases pressure on the prostate and helps the body restore balance. Here's how to do it step by step. Lie face down on the floor or a yoga mat, legs extended, toes pointing back. Place your palms flat on the floor, just under your shoulders. Slowly press into your hands, lifting your chest off the ground while keeping your hips down. Hold the stretch for 10 to 15 seconds, breathing deeply. Lower back down slowly and repeat 5 to 7 times. Benefits include: white heavy check mark, improved blood flow to the lower abdomen and pelvic area. White heavy check mark, reduced lower back stiffness. White heavy check mark, better bladder and prostate function due to increased circulation. This movement also opens up the chest and improves posture, making breathing easier and more efficient, something many men overlook when they think about prostate health. Think of the cobra stretch as a way of telling your body, relax, release, and heal. It's not about pushing hard, but about giving your body space to recover. The sixth and final exercise is one of the simplest, yet it may be the most powerful of all: walking. Now, I know what you might be thinking: walking seems too easy. But here's the truth. Consistent walking improves circulation, lowers inflammation, helps maintain a healthy weight, and reduces the pressure on your prostate. In fact, studies have shown that men who walk briskly for just 30 minutes a day experience significantly fewer urinary symptoms from BPH. Here's how to do it effectively. Aim for at least 20 to 30 minutes of walking most days of the week. Walk at a pace that makes you breathe a little faster but still allows you to hold a conversation. Focus on good posture. Stand tall, shoulders back, core engaged. If 30 minutes feels overwhelming, break it into 3 10-minute walks throughout the day. Benefits include white heavy checkmark, reduced urinary urgency and frequency. White heavy checkmark, lower stress levels, and stress is a big trigger for prostate problems. White heavy checkmark, improved heart and overall body health. White heavy checkmark, natural weight control, which decreases pressure on the prostate. Walking doesn't just strengthen your body, it clears your mind, lifts your mood, and reminds you that you are in control of your health. So, my friend, these 6 simple exercises, Kegels, pelvic tilts, bridges, knee-to-chest stretches, cobra stretch, and walking, are not just routines. They are tools to give you back your strength, freedom, and confidence. Remember this: prostate enlargement is common, but suffering in silence is not necessary. Through discipline, belief, and consistent action, you can take control of your health and live with vitality at any age. Because you are not defined by your age, you are defined by the decisions you make today. And the decision to move, to strengthen, to breathe, that is the decision to live fully.